There is one thing you are doing every single morning that your heart is silently paying for. Not a list of habits, not 5 things or 6 things or 10 things to change. One thing. One specific morning behavior that I have watched contribute to cardiovascular damage in my patients over and over again across more than 2 decades of clinical practice. And the reason I am making this video today is that this particular habit is so automatic, so deeply wired into the morning routine of almost every senior I treat, that most people do not even register it as a choice anymore. It simply is what they do, every morning, without thinking, without knowing what it costs. My name is Dr. Calvin Hayes. I am a cardiologist, and for over 20 years my practice has focused exclusively on adults over the age of 60. I have seen what morning habits do to an aging heart up close and in real time. I have sat across from patients who did everything right and still ended up in my office with blood pressure readings and arterial damage that should not have been there. And when I traced it back, when I asked the right questions, the morning always came up. Stay with me, because what I am about to tell you is something I wish I had the opportunity to say to every single one of my patients before the damage was already done. And the part that is going to surprise you most is not what the habit is. It is how simple the fix turns out to be. The habit is standing up the moment you wake up, not dramatically, not with any particular force. Just the ordinary, automatic, completely unremarkable act of opening your eyes and immediately swinging your legs off the bed and rising to standing within 1 or 2 seconds of waking. Something you have done every morning for decades. Something that has never once felt like a problem because it does not feel like anything at all. But inside your body in those 2 seconds, something very specific is happening. And after 60, that specific thing becomes genuinely dangerous in a way that almost nobody is talking about clearly enough. Let me explain exactly what is going on. When you sleep, your entire cardiovascular system shifts into its lowest demand state of the day. Your blood pressure drops naturally. Your heart rate slows. Your blood settles and pools toward your core and your lower body. Your blood vessels relax. Your autonomic nervous system eases into a quiet, low-activity rhythm. This is exactly what sleep is supposed to do. Your cardiovascular system is resting and recovering. It is running at the minimum it needs to keep you alive and nothing more. Then your alarm goes off, and within 1 or 2 seconds you stand up. In that instant, gravity does something powerful and immediate. It pulls a significant volume of blood downward, away from your brain, and away from your heart simultaneously. Your brain suddenly has less blood supply than it needs. Your heart suddenly has less blood returning to it than it requires to pump effectively. Your body has to compensate for this shift almost immediately, or you will feel faint, dizzy, or worse. In a younger cardiovascular system, this compensation is almost instantaneous. The blood vessels constrict rapidly. The heart rate spikes briefly to push blood upward. The autonomic nervous system fires quickly, and the whole adjustment happens in 1 to 2 seconds so smoothly that you never notice it. But here is what changes after 60. And this is the part one need you to really hear. After 60, the walls of your blood vessels have stiffened, not dramatically, not in a way you can feel directly, but measurably and significantly compared to what they were at 40. Stiffer vessel walls cannot constrict as rapidly or as effectively in response to that sudden gravitational pull on your blood. And the autonomic nervous system begins to slow down with age. Its response time lengthens, its precision decreases. The result is a window of several seconds, sometimes longer, where your blood pressure drops significantly before your body can catch up and compensate. This is a clinical condition called orthostatic hypotension, which in plain language simply means a sudden drop in blood pressure caused by standing up. And in adults over 60, it is far more common than most people realize, far more consequential than most doctors take the time to explain, and far more connected to serious long-term cardiovascular risk than the brief dizzy spell it sometimes produces would suggest. I want to give you the number that stopped one of my patients cold when I shared it with him. A large-scale study involving over 11,000 middle-aged and older adults found that people who experienced significant blood pressure drops upon standing had a 54% higher risk of developing heart failure compared to those who did not. 54%. From the act of standing up too quickly, every single morning, think about what that number actually means. This is not a marginal risk. This is not a statistical footnote. 54% higher risk of heart failure from something you do in the first 2 seconds of every single day. And here is what makes it so insidious. It does not always announce itself with fanfare. You may not faint. You may not fall. You might simply feel that brief split-second wave of lightheadedness, that familiar sensation where the room tilts slightly before correcting itself, and then it passes, and you move on with your morning and think nothing of it. Maybe you have felt it so many times it no longer even registers as unusual. But I need you to understand what is happening inside your cardiovascular system in that moment. Your heart is not simply adjusting smoothly, it is being forced into a sudden emergency response. It is being asked to dramatically increase its output within seconds to compensate for a blood pressure drop it was not prepared for. The electrical system of your heart, the vessel walls, the valves, all of them are absorbing the stress of that emergency response. Once, and then again the next morning. And the morning after that, 365 mornings a year, year after year. Cumulative cardiovascular stress does not announce itself. It builds quietly, invisibly, until it is no longer quiet and no longer invisible. Have you felt that brief morning tilt, that split second where everything shifts slightly before righting itself? Most of my patients over 60 have felt it so many times they stopped noticing it. If that is you, I need you to sit with what I just told you about what that sensation actually represents. Not to frighten you, to give you information that changes what you do tomorrow morning. Now I want to tell you about a patient of mine named Howard, 73 years old, retired engineer, sharp, disciplined, the kind of man who took his health seriously and followed every instruction I gave him to the letter. He was on 2 blood pressure medications, both carefully chosen and carefully dosed. His readings at my office were consistently acceptable. He exercised 3 times a week. He ate well. By every clinical measure, Howard was managing his cardiovascular health responsibly. And yet Howard kept telling me something that did not add up. His home blood pressure readings first thing in the morning were consistently higher than his in-office readings, high enough that he had mentioned it at 3 consecutive appointments and been told each time that morning variation was normal and not to worry. I decided to ask Howard something specific that I had not asked before. I asked him to describe exactly what he did in the first 60 seconds after waking up. Walk me through it in detail. He thought about it and said, I open my eyes, I check my phone for the time, I sit up, and I go straight to the bathroom, all within about 30 seconds of waking up. I asked him how fast he went from lying down to standing. He said, pretty fast, I suppose. I never thought about it. That was the answer I was looking for. Howard was standing up within seconds of waking every single morning. His blood vessels, already stiffer than they were at 50, were being asked to manage a sudden gravitational blood pressure drop before his autonomic nervous system had even fully transitioned from sleep state to waking state. His heart was beginning every single day in emergency compensation mode, and his morning blood pressure readings were reflecting that emergency response directly. We made one change, one single change to Howard's morning. Nothing to his medications, nothing to his diet or his exercise, just the first 60 seconds of his day. Within 3 weeks, his morning home readings had dropped by an average of 14 points systolic. 14 points, from changing what he did in the first 60 seconds after opening his eyes. Nothing else. That is the power of this single morning moment. And that is why I am making this video today, rather than a video about 6 different habits or 10 different changes. Because sometimes one thing done differently and done consistently changes more than everything else combined. So let me tell you exactly what that one change looks like. And I want you to hear how simple it is, because I think part of what makes people dismiss this is that the fix sounds almost too easy to be real. When you wake up tomorrow morning, do not stand immediately. Lie completely still for 30 seconds first. Not 30 minutes, 30 seconds. Use that time to let your body begin registering the transition from sleep to waking. Let your autonomic nervous system start its warm-up. Let your blood pressure begin its natural morning adjustment process, from the horizontal position where it is safe and supported. Then slowly move to a sitting position on the edge of your bed. Not quickly, slowly. Let your legs hang down toward the floor. Sit there for another 30 seconds. In this position, your body is already beginning to manage the gravitational redistribution of blood, but you are still close to the ground. Your heart is not yet working against full gravity. Your vessels have time to begin their compensatory adjustment before the full demand of standing is placed on them. Then and only then stand up, slowly, using the bed frame or a nearby surface for support if you want additional security. The entire sequence takes 60 seconds longer than what you are doing right now. 60 seconds. That is the complete cost of this change. 1 minute of your morning in exchange for removing a significant source of cumulative cardiovascular stress that has been building every single day for potentially years. I want you to also understand something that makes this even more important for many of you watching. If you are taking blood pressure medication, and statistically the majority of people watching this video, are certain blood pressure medications cause a mild initial drop in blood pressure shortly after being taken. If you take your medication first thing in the morning and then stand up quickly, you are combining a medication-induced pressure drop with an orthostatic pressure drop simultaneously. That combination can be significant. It can produce dizziness, serious enough to cause falls. And falls in adults over 65 are among the leading causes of serious injury and hospitalization. The interaction between medication timing and morning standing habits is something I discuss with almost every patient on blood pressure treatment. And it is a conversation that almost never happens spontaneously in an 11-minute appointment unless the patient knows to ask about it. Now you know to ask about it. You deserve a morning that supports your heart rather than silently stressing it before your day has even begun. And the remarkable thing about this particular change is that it costs you nothing. No prescription, no equipment, no money, no particular level of fitness or mobility. Simply 60 seconds of intention at the start of your day. Howard told me at his next appointment that he could not believe something so simple had made such a measurable difference. He said, "I have been doing this every morning for decades, and nobody ever told me it was a problem." That is exactly why I made this video, because nobody is telling you either, until now. Tomorrow morning, when your eyes open, I want you to remember one thing. 30 seconds lying still, 30 seconds sitting on the edge of the bed, then stand slowly. That is it. That is the entire change, and your heart will feel the difference even if you cannot. Which part of what I shared today surprised you most? Was it the 54% statistic? Was it Howard's story? Or was it simply the fact that something this automatic and this ordinary could carry this kind of cardiovascular cost? Tell me in the comments below. I read every single one, and your response helps me understand what information matters most to the people watching. Share this with someone over 60 you care about. Because this is the kind of thing that changes a morning routine forever. And a changed morning routine, sustained over months and years, changes outcomes in ways that nothing else can. And subscribe because my next video tackles something that happens in the first 5 minutes after you stand up, a habit that compounds everything we talked about today and that almost every senior is doing without any awareness of the cost. You are going to want to see that one.